Black coffee can stain your teeth. To avoid that, use the no-touch technique. Watch.
Pregnancy, labor and delivery are over. Now what? There is a list of basic things you need to check before you go home. Let's start with feeding your baby. Breast milk is always preferred. It's cheap, available, has minerals and vitamins, and antibodies that fight infections. Bottle feeding is also acceptable. If you want to stop your breast milk, wear a tight bra, avoid hot water on your breasts, and nipple stimulation. If you choose to breastfeed, use supportive bra. Use lanolin cream for cracked nipple. If you develop any redness, pain, or start running fever, contact your doctor immediately. After delivery, pelvic rest is advised for a few weeks. Avoid inserting a tampon and avoid intercourse until you are cleared by your doctor. After a cesarean section, avoid heavy lifting and driving as you may not be able to use the emergency brake due to pain. Generally speaking, if you had any kind of sutures, whether vaginal or a cesarean section, baths are better avoided. Take showers instead. There is a variety of birth control that your doctor can discuss with you. If you have any preference, make sure you inform your healthcare provider. Depression is not uncommon after birth. Sometimes things can get overwhelming. Disclose any concern you have. There are options like counseling and medications to deal with this problem. Car seat test will be done before you leave the hospital. The hospital days are behind you, but before you leave, make sure you have a follow-up appointment in clinic. Now it's time to make memories with your baby. If you want to support this channel, please like and subscribe. Click on the bell to be notified when a similar video is posted. Feel free to share and see you next time.